Welcome back to Disruptive Doctors GP series. I'm your host, Dr. Selena, the co-founder of Disruptive Doctors, and this is a second part of our two-part conversation with Dato Vincent from KL Wellness City. Now, today we're talking about something that many doctors haven't considered: wellness real estate. It's more than just a buzzword. It's changing how people live and how healthcare is delivered. So let's break it down today and see what it means and how it creates new opportunities for doctors. Hi, Dato Vincent.
Hi, Dr. Selena. Hi, everyone.
Okay, let's clarify the term. What is wellness real estate?
Okay, so to begin off, real estate is actually a definition coined by the Global Wellness Institute, GWI. And GWI actually had a very good, clear definition of wellness real estate. And it is defined as, if I follow and read out the definition, the construction of residential and commercial or institutional properties, including office, hospital, mixed use, medical, and leisure, that incorporate intentional wellness elements in their design, materials, and constructions, as well as the amenities, services, and the programming. So what is that? In short, it is actually the development of spaces and communities designed intentionally, master planned, carefully, tailor-made, created, designed intentionally to support physical, mental, and emotional health. So for doctors, especially specialists or even GPs exploring new patient engagement models, wellness real estate becomes an avenue, a platform, a geographical area that enables and allows the doctors to have a new way to practice within this kind of carefully crafted, created environment that enables the availability of a lot of resources and services related to medical as well as wellness living. So in short, being in this kind of ecosystem, like an example, when we incorporated KL Wellness City adopted this wellness real estate, and to recap on the definition, it means that in KL Wellness City, there's residential, there's commercial, there's hospitals, there's mixed use like retail, there is medical clinics, individual medical clinics, there are medical centers, there are ACCs, ambulatory care centers, there are leisure like the parks, the gyms, the wellness centers, all right? And all these were intentionally, carefully, purposely crafted and put in to be interconnected in this little township at Bukit Jalil, at KL Wellness City. So when we went around to look for this wellness real estate definition, especially pre-COVID, we were studying it. And then during COVID, we were looking around it in Southeast Asia. And then even after COVID, we realized there's no city, no development, no township in Southeast Asia that adopted this carefully master plan from the first day. Master plan means what? It started from one brain, like a government or a private entity, carefully designing and putting the plots in, putting the components in, and making sure the infrastructure and also the soft systems are all integrated from one building to another building, from one building providing the services to another building, and it's integrated, it's related. So in some countries like Singapore, you happen to see a couple of these components together, but they all most of them belongs to different organizations and companies. So the government make an effort, try to put everybody together, try to put the whole ecosystem and interconnected, and name it to be a health city, for example, in certain of the parts in Singapore. So that it's an afterthought. It's an after all things happen, then you try to jive and put everyone together. But whereas a wellness real estate is usually in the case that it is purpose-built and started right from the scratch, a brownfield, and then you carefully design it so that it can create the most impactful results efficiently, or should I say cost efficiently. So a very quick one, just to add on, Global Wellness Institute, GWI, reported that the global wellness real estate market grew from USD 225 billion ringgit, 225 billion USD in 2019 to USD 398 billion USD in 2022. So despite the 3 solid years or 2 years of pandemic or COVID, the wellness real estate market, market size continued to grow. In fact, because of COVID, because of pandemic, thereafter, all countries in the world, in particularly Asia Pacific, the market grew even larger. So from 225 billion USD in 2019 to 398 in 2022. That's only a short 2-3 years. It shows that how rapidly this sector is gaining traction. And this reflects not just a trend, but a global shift towards the health first living, the wellness living in this new era of environment that everyone is now more cautious, particularly globally towards an aging nation.
Yeah, I guess the across the globe, they, we are a lot of us are aging nations, low birth rates, more older people, and people are living longer.
Correct.
So I like how you mentioned that this is an entire township that's crafted with wellness in mind. I
Mm.
think that was very when you mentioned that, I was just thinking, wow, this is amazing. If I would want to be in that wellness center, because everyone is so much more concerned about their health, their well-being. Like longevity medicine is a new, like one of the biggest growing sector as well. So would you say that this is a new business opportunity or investment opportunity for doctors, in this kind of model?
Yeah, actually, when the wellness real estate terminology and definition is defined, it actually makes the availability, the interconnectivity, and the integration of all the medical services, the living, the commercial, the office space itself. This also means that the people who live in the city actually, first of all, the thoughts they already realize that they will want to put priority on their health, on the care, and or not just a thought, there are needs. That's why people stay there. That's why people go over there. So that actually means that for medical doctors, having their clinic practice or their medical centers becomes naturally an advantage because you are within a pool, a sizable town that it's attracting global patients. You are attracting global healthcare travelers to a city. Now, so for example, if you open up a say aesthetic clinic, for example, and you open up in a certain town, how much marketing budget do you have? How much investment do you need to put in to brand and promote yourself and your services and all that? A lot. And you still need to do it within a certain framework that is allowable by the KKM, for example. If you are, this similarly applies to, let's say you are orthopedic, for example. But when you are in a city, KL Wellness City, or Wellness Real Estate Township itself, it means the people who move in and stay there, they were very cautious and they are aware, fully aware, and they pay attention and have care on the needs and the actual real needs and demanding a certain level of medical care. So ecosystem is the keyword I'm trying to say. Wellness real estate is a creation of ecosystem. All right. Now, from the whole township. So imagine if you're setting up your orthopedic center. It could be a chain practice. It could be your own clinic. It could be a 4 or 5 orthopedics coming together, setting up our medical center itself. When you brand yourself in your clinic itself, you also be branding it and say, I'm at KL Wellness City. And everyone globally, and be it in Singapore, Indonesia, and the rest, will start to learn and know that it's not just your name of clinic itself. It will also carry weight in understanding the branding of the relation of what KL Wellness City resembles or represents or attracts. So the opportunity is great. First of all, you save on your branding marketing, but most importantly is the ecosystem that I mentioned just now. The cross referral of businesses, the cross referral of medical services, of cross referral of patients. Why? If you are in this medical city itself, in this medical city, you could be an orthopedic, but your patients next day is a patient that it comes from that is referred by maybe a neurologist and referring to you orthopedic because while they were treating the euro matters, they realized there were other issues that has to be treated. Sometimes you find it that it's so different, but the need is there. So the cross referral becomes that everyone in the whole township, not necessarily you are side by side each other, but the ecosystem is what that attracts. And just imagine if I'm from Bangladesh, I'm from Cambodia, and I would like to trying to source and find and get 2 or 3 good opinions before I go for major cancer treatment or go for my orthopedic kind of operations, etc. So if I come to KL Wellness City, I will have maybe a couple of orthopedic choices centers for me, doctors that I can speak to and get my second opinion, third opinion before I make my final decision. Okay, I'm ready to do my full operation. Perhaps, and this is what it makes it that you one-stop center. You come over, you will see a few of them, choices. Most, and in this era, most healthcare travelers will do a little bit of survey, market survey, about reading, get to know about the doctors, etc. That. And what better than if you come to a big ecosystem where time is no issue of waiting for any immediate care, availability of hundreds of doctors there, availability of a big hospital with all the amenities and the newest and best possible equipments in town. So I'm sure that if they have the money and come from Cambodia and they are coming from Singapore, why didn't they stay back in Singapore? Because it's just simply too costly already. All right. And why some of them come from China? When they come from China, the wife comes from certain treatment, the husband stays on, waits for the wife. In the meantime, that 5-7 days, the husband continue to do other screening because he's just there waiting for the wife, maybe doing IVF treatment or doing some treatments. So with the so many availability of affordable, good care, good services, the husband probably would say, "Oh, I'll just do a bit of health screening and I'm a guy above 40, 45. I've not done screening or I've done my NGO or whatever in the past 45 years. Might as well do it lah, because once I schedule make appointment, I can do it in the afternoon already. My report is even out before my wife even finish her 7 days of treatment and all that. So this is the ecosystem. It's availability and it's very cost effective.
I think that's really brilliant because, like what you mentioned, if a GP just sets up its own clinic in the middle of nowhere or a more secluded place, you have to do so much more by yourself. But if it was part of an ecosystem like KL Wellness that's built with all this in mind, the effort that they actually have to put in can be focused on their patient care instead of other things like marketing, branding themselves, and all that kind of stuff.
Correct, that's true. Because the KL International Hospital will be doing a lot of roadshows, conferences, symposiums, and engagements, talks, and all that outside of Klang Valley. And also overseas, we would invite the doctors that is actually in KL Wellness City's medical suites, medical towers, like the Nobel Healthcare Park, the doctors an opportunity to join the KL International Hospital for such conferences and congresses and roadshows and engagements and talks and all that. This is an important avenue because you need a big hospital to champion and start open up the door and start scheduling and all this engagement. Because otherwise, as a single GP yourself or as a single specialist yourself, how much time do you have trying to do your own marketing? You can't employ a marketing person in your clinic. And it's just simply maybe too small a clinic to do too much to employ one marketing person. If you think that, oh, okay, I'm going to pay 3K, 5K, 7K, 9K for a social media marketing company to try to brand me and to put me SEO, put me in the highest rank, in the Google and etc. and all that, and hoping with that the people will see me and read me and then come to me. Well, everyone's doing that. So you need to you need someone else like a big hospital to do this for you at no charges, and then you just tag along and grow from there as well. Because your international exposure is something that is sometimes too costly for you to do it yourself. But imagine if maybe you are a cardiologist, and then two of you all want to open up a cardiac center, etc. and all that, and you have a little bit of some Indonesian patient, but you don't have that many Indonesian patient, and then you'll be wondering, so how are we going to do marketing and how are we going to draw more Indonesian patients to come? Are we going to spend in that every month 12,000, 15,000, 18,000 ringgit to try to blast and try to promote to Indonesia? Well, it's such a big country, your money may not be seen anywhere. It may not be effective. But when the KL International Hospital does and goes for international roadshows and plans and congresses and planned and arranged by us, and then you are one of the speaker, you're one of the team members that go along to Jakarta, to Palembang, to Medan, to Pontianak, etc. and all that. Hey, your presence and your awareness and you're very visually you know of clearly at the place, the patients and the agents they can see you, the local clinics, the local doctors there, they will engage and meet you as well. So there's a name to a face, say, Dr. Alex Lee, okay, now I know, oh, you are the one of the this is your specialty. You have been doing this. Okay. We are just 1 or 2, 3 clinics over here in Medan. We can do a little bit collaboration. Next time we will refer them to you. things like that. But if you don't walk out from your clinic, how are you going to do medical tourism?
Yeah,
You will only
but
probably
that's
just depend on the expatriate in Malaysia. That's all.
correct, correct. And I think a lot of doctors, I mean GP doctors, do not have time to go out to do all
No.
of that.
Yes,
Yeah.
yes, yes. And this is optional if you have the depending on the availability, because there's going to be a lot of consistent kind of road shows, etc. There, and whichever one that you are available and you're able to make it, do tag along, and that's very important. It's like someone opened the door. The hospital already opened the door. But you don't need to participate. You just join. Like you must participate and get involved, and then you can open up door for your for a much better possibilities of reaching.
Okay, thank you, Dato Vincent, for helping us connect the dots between healthcare, real estate, and the future forward thinkingness. So, for our audience, those of you who are interested in partnering, being part of KL Wellness, be sure to check the link. And Dato Sri Vincent will be at our conference, the Disruptive Doctors Conference and Exhibition, this 20th and 21st of September in Sime Darby Convention Center. You can come, speak to him, find out more how you can invest, how you can open up more business opportunities for your clinics, and how to get involved. Until next time, stay curious and keep building the future of healthcare. Thank you.
Thank you.
Join Disruptive Doctors. Oh, oh, Disruptive Doctors. Impact.